So today we are going to study about the anatomy of the skull-base foramens. We are going to also learn the clinical importance and the surgical implications. So let's start the lecture.
Alright, so this is the axial view of the skull base. Actually, so if you can just slice out the calaveria, upper part of the skull bone, you will see from top and this is the cranial fossa. So I have made this diagram and divided this cranial fossa into three parts, as you all might be aware. So this is anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. We'll discuss about the boundaries later about the cranial fossa. Our main topic here is to know all the important foramens and the content in those foramens. We're referring to this main diagram again and again as I go through this whole lecture. Alright, here this is the anterior cranial fossa, and there are four foramens which we need to remember here. It's foramen cecum, cribriform plate, anterior ethmoidal foramen, and posterior ethmoidal foramen. The cribriform plate, you may ignore it as a foramen because it is several perforations through which the olfactory nerve passes. So you should not consider that as foramen, but you see, just to keep it in the list, I just anterior cranial fossa, and as I mentioned, we are going to discuss about the four foramens which are basically present in the ethmoid bone. Now, foramen cecum basically consists of nasal emissary veins, which eventually connects the superior sagittal sinus. I hope you all are aware of this terminology of superior sagittal sinus. However, if you don't know, I'm going to make a separate lecture about all the venous system in the brain. Okay, so don't worry about that. Now next is cribriform plate. Well, again, it possesses the olfactory nerve fibers that passes through it, and as we know, it's a first cranial nerve. Also, these nerve fibers are basically the bipolar neurons. And one more important clinical implication of this cribriform plate is this. Now, when the cribriform plate undergoes fracture, this is the fracture, okay, caused by traumatic brain injury, TBI, results into CSF rhinorrhea. Now, the cribriform plate can also be damaged iatrogenically, but eventually it ends up into having a CSF rhinorrhea. Now, in this case, why is it important to be treated? Because again, it is like an open connection of the environment to your brain, basically. And if CSF is leaking, that means the dura has been breached and your whole brain is more susceptible to get infection. So now this case will be taken care by neurosurgeon or an ENT surgeon, or maybe together. So basically what they will do is they will repair this fracture by placing a patch. Now this is done by endoscopic or transnasal repair technique with a nasal turbinate graft. It's basically a mucosal patch which they place on top of the defect or the fracture line, and that's how they seal the leakage. So that was one of the important implications of knowing cribriform plate. Now let's come back to this anterior ethmoidal foramen. Now it holds all the neurovascular bundle, ethmoidal artery, vein, and nerve, which is basically a branch of nasociliary nerve. And it supplies the anterior ethmoidal sinus, basically the sensory part. Now there is a posterior ethmoidal foramen as well, which also holds posterior ethmoidal neurovascular bundle, artery, vein, and nerve. And this nerve supplies the posterior ethmoidal sinus and posterior sphenoidal sinus. Now, sphenoidal sinus is important in neurosurgery, as through this only we get an access to the pituitary gland, especially for the pituitary tumor. Again, this whole surgery is a transnasal approach, an endoscopic approach. So yeah, this is something we should be aware about. And I also mentioned the distance between this anterior ethmoidal foramen and posterior ethmoidal foramen. Why? This distance 1.2 centimeter to 1.5 centimeter around. Yeah, if you want it's 12 millimeter or 15 millimeter. But why is this distance important? Because this distance is considered in the surgery like orbital decompression surgery in case of orbital cellulitis. Okay, so that's about it. Learn about the foramens in the middle cranial fossa. So there are basically 6 important foramens. I would consider the superior orbital fissure into this as well, even though it's a fissure, not a foramen, but it is equally important. It's actually rather very important. So I consider that into this as well. And that is definitely foramen rotundum, foramen ovale, foramen spinosum, optic canal, and foramen lacerum, right? So let's talk about the foramens in the middle cranial fossa. Now, all the 6 foramens are present in this sphenoid bone. Okay, so let's start with the superior orbital fissure, where it holds very important cranial nerves that controls the movement of the eye, including 3rd cranial nerve, 4th, and 6th, oculomotor trochlear abyssins. Also, it possesses the 5th cranial nerve, the ophthalmic division, is called V1. It gives off 3 branches like lacrimal nerve, frontal nerve, and nasociliary nerve. Now this nasociliary nerve I have connected here up here as well. So basically the anterior sinus, the sensory supply is via nasociliary nerve, which is basically part of the trigeminal nerve, ophthalmic division. Also it possesses recurrent meningeal artery, which is again branch of the facial artery, and superior ophthalmic vein. Okay, now I will make a separate whole video lecture regarding the orbital fissure and the contents of the orbital fissure in future videos. Now come to the foramen rotundum. It holds the maxillary nerve, which is the V2 component of the trigeminal nerve, and foramen ovale. It's very important. It consists of mandibular nerve, which is again the V3 component of fifth cranial nerve. Also below the mandibular nerve, actually below the foramen ovale and next to the mandibular nerve, is the otic ganglion. Now this is a very important ganglion as it is like a parasympathetic control center. And also the lesser petrosal nerve, which is again the branch of 9th cranial nerve, acts as a preganglionic parasympathetic fibers from the tympanic plexus to the parotid gland. Now this nerve synapses with the otic ganglion, so basically they are internally connected. Okay, and also it possesses accessory meningeal artery and some emissary veins. Now again, accessory meningeal artery is a branch of facial artery. Well, sometimes it may not be present, so could be a anatomical variant. Okay, also now we go to the foramen spinosum, which is very important, although it is very small foramen, but it is very important because it holds the meningeal branch of the mandibular nerve. It's like a recurrent branch. As the mandibular branch exits, it also gives a recurrent branch which enters the calaveria again through this foramen spinosum as a meningeal branch of mandibular nerve. Supplies basically the dura mater. Okay, now the important artery, middle meningeal artery. I hope you all are aware of it. It has 2 branches, anterior and posterior, and this artery is primarily the branch of facial artery. Facial artery eventually entering into as a maxillary artery and then giving a branch of a middle meningeal artery. And why this is important? I think everyone is aware that injury to this artery can result into epidural hemorrhage, and this is very serious neurosurgical emergency. I will make a whole video regarding the traumatic brain injuries and specifically how to identify the EDH, types of EDH, how to nomenclature of the EDH, even calculating the size of EDH just by seeing the CT scan. Okay, is the foramen lacerum. Well, it is called lacerum because it has lacerated or jagged edges. It has 2 parts, extracranial part and intracranial part, and it's like a kind of sigmoid or turning canal through which the internal carotid artery enters and opens up into the cranial cavity. This twisting and turning results into different segments of the internal carotid artery, which I will be making a separate diagram for it, and it is very important from neurosurgery point of view. So I'll make a separate diagram for that later. Also, this foramen lacerum along with the internal carotid artery possess the sympathetic plexus. It's basically a whole network of nerves that surround the carotid artery, and basically they are sympathetic plexus, so basically they control the vasomotor tone of the internal carotid artery. and from which arises the deep petrosal nerve. Okay, now this deep petrosal nerve, in conjunction with the greater petrosal nerve coming from the facial nerve through geniculate ganglion, they merge together to form the median nerve, which is basically also called as nerve to the pterygoid canal or nerve to median canal, vice versa, whatever you like. Now this greater petrosal nerve is a parasympathetic branch, and whereas this deep petrosal nerve rising from the sympathetic plexus, again, it's a sympathetic branch. So basically median nerve possess parasympathetic and sympathetic fibers. Majority is parasympathetic and less is sympathetic. Now median nerve is very important. Why? Because median nerve controls the vasomotor tone of the vessels in the nose, okay, specifically in the nasal mucosa on the turbinates and everything. So controlling release of nitric oxide and vasoactive intestinal peptides. This basically controls the vasomotor tone, and also controls this nasal secretion by releasing acetylcholine on the M3 receptors. Now this plays a very important role in the pathogenesis of a condition called vasomotor rhinitis, or secondary to allergic rhinitis. Well, this condition, many people have this condition, even I have this. So most of the time it is controlled by the nasal decongestant drops or steroids. However, if something like that is not able to control this, we have to go to a surgery called endoscopic video neurectomy. Basically, we just cut these two nerves and the control is gone. So the patient won't experience the parasympathetic overflow and vasodilation in the nasal mucosa, and the turbinates won't swell up. So that's the basic idea of this surgery. And again, as I mentioned, this nerve exits through pterygoid canal, enter into pterygopalatine fossa, and relays with the pterygopalatine ganglion, from which the nerve fibers, post-ganglionic nerve fibers, enters the nasal mucosa and do all these things. Okay. Now one more is optic canal. It possesses the optic nerve, second cranial nerve, and the ophthalmic artery, which branches out to central retinal artery. Okay.